The mid-tier, what are they looking for? They'll look at everything. They're exhausted. So most of them are going to do a QOE.
Yeah.
So they are going to comb through the financials extensively. They are going to have their chief dental officer, right? Or if it's a medical practice, their chief medical officer come in and do a thorough review of the operations of the business so they can pick out any strengths, weaknesses, opportunities, threats, right? They're going to go through that complete analysis on the operations. They're going to divide everything up into little fine, they are detailed. So at the end of the day, those sales take time. They take a lot of effort on the seller's part. We try to organize it the best we can for them. But at the end of the day, they're like, wow, I can't believe how much work that was. But that buy box, what they're looking for is they like multiple dentists, multiple clinicians, because usually one wants to exit. Yeah. So I mentioned that one that's doing 4 million. It's a single clinician. That's a problem. So it's been a tough sell. But the ones with 4 clinicians in it, that was an easy sell. I had another one with 10 clinicians. That was an easy sell. So they're just looking for continuity of cash flow with, let's say, they're looking for the synergies and opportunities that their larger organization can implement to generate even additional cash flow in that business.
Okay. And so when you have like a deal with like multiple dentists, what does the deal structure look like? So for example, like the 7.5 one, what was that structure like? How much of it was cash? How much of it was earn out? How much of it was need to be rolled into equity, rolled into the, like, I don't know if they roll into the individual branch or they roll into the larger entity. What does that look like?
Yeah, it was about 80% at closing, and then
80% cash at closing.
80% cash at closing on that one. And then what they did was there was like 20%. What they did is they did it in 3-year installments for the owners, and those installments were paid out based on retention.
Okay.
So if they stayed in the business working, they not only received their percentage of collections for doing the work, they received that kind of additional earnout, but that earnout was 100% based on retention. So it had nothing to do with continuity of revenue or bottom. Just stay in the practice, make it look like nothing happened. While we changed the name eventually, so people think, hey, it's the same old. And then eventually, when you're ready to leave permanently, we'll replace you.